Hi, I'm Mark Olives, and today I'd like to talk about some of the worst exercises that you can do for your back. And these are exercises I see people regularly engage, and they think that they're doing good things for the back, but in actuality they're really doing some bad things for the back. And it usually surprises people when I tell them what they're doing is wrong. So, excuse me, a couple exercises that are really bad are spinal extensions. So if you're in the gym and you're in one of those machines where you're bending back and forth like this, studies have shown that is a fantastic way to injure the discs in your spine. Why? Because your spine is actually in a flexed position because you're sitting. That's a very vulnerable position for the disc. It puts a lot of stress on the disc. And then you're asking your body to extend. Now, with these machines, you're using a lot of weight. And what that does is it engages a lot of muscle. Now, you might think, well, that's exactly what I want to do. I'm trying to engage and build muscle. I say, yeah, but you don't really necessarily want to do that because you have to remember that anywhere a muscle crosses a joint, it will cause compression of the joint. So many of these muscles in your back, they're running from your neck down to your low back. When you contract those muscles, there's compression, and that's going to squish the discs. So if you've already got a problem with your back, you've already got a bulging disc, and now you load it, you really compress it, you're really asking for trouble. So this is a bad activity. Another bad exercise is just kind of the reverse, the crunch machines, but it's the same exact principle. You're doing a high load. You don't need to do that. I've got another video that talks about how to do crunches in a better, more efficient fashion. But when you do a crunch machine, you got a high load. Again, you're in a flex position, which is vulnerable for the disc because you're putting pressure on the front part of the disc. That's moving the fluid material in the disc to the back of the disc where it's most likely to bulge. And this is what's going to create problems. Plus, you're outside of a functional position. When you strengthen muscles, you only strengthen them in the position that you're executing the activity in. So when I'm in this position, that's great that I got great strong abs when I'm flexed up. But I don't really need to lift anything or do anything when my spine is all flexed. I lift with my back nice and straight. So the crunch machines are not effective because they're putting a large load and they're placing you in a position where you're not getting the most benefit for those muscles. Lastly, the stability balls or the exercise balls. Now this is more for people that have back problems already. Now if you don't have any back problems and you're doing things properly, you can derive a good benefit from these. But the big reason I don't ever have any patients with back pain do any exercise on the stability ball is because of kind of the same reason I've already mentioned. The more muscles I engage during an exercise, the greater the compression on the spine. Now, if I'm doing just a regular crunch on the stability ball, I'm having to balance staying on that thing. And so what's happening is I'm pulling in muscles from the front, from the side, and even probably in the back. And if they're all contracting, they all are crossing numerous spinal levels. So again, anywhere a muscle crosses a joint, it will compress. So these obliques, they're starting here, going down to here. Abdominals starting here, going down to here. And the erectors of the spine, like I said, they're starting and finishing clear across the whole spine. So now I've got all these muscles all the way around the trunk contracting and compressing the spine. That is horrible. So I never have patients that have back pain work with the stability ball. So those are the three things that I would typically say. Don't do those at the gym, especially when you have back pain. And I hope that this helps you to have a healthier, happier back. Thanks.